in Central Research Council of Homeopathy. I request Dr. Pritha to take over the program right now. Thank you so much.
Over to you, Dr. Pritha.
Thank you, Bidyut, Praleda, for making me the inaugurator for the 70th online CME. It's a great privilege that we are having these kind of CMEs organized every month, and the whole credit goes to the whole team and especially to Bidyut. For today's session, without making any delay, I would like to introduce. We are having two very good speakers with us today. One is Dr. Narayan Kalyani sir. He will be talking about his journey of 300 cases of degenerative joint diseases. And we have the other speaker, Dr. Akashbonti Sonowal. She will be talking about cosmetology and homeopathy. I could see that there is a huge difference between the two speakers, in the sense that one is a very what to say experienced and renowned physician, and he is most loved one among the NIH Alumni Association, and being the president also. And the other one is from the 19th batch BHMS. However, to make a presentation at such a young age in this organization, I think it's a huge privilege for her as well. And it's like a generation gap when we will hear to Dr. Kalyani, and there's no point of discouraging Dr. Sonowal, because it's actually a very good platform she is getting. And I believe that when she has chosen this topic of cosmetology with homeopathy, we all understand that there are skin diseases which are curable in homeopathy, and whereas in the conventional system they have their own limitations in this regard. uh, I will not say much about the degenerative joint diseases, because Kalyani sir is one who has such a vast experience, and we all understand with age, with the changes that occur in the joints and bones uh, with aging, so that can be explained holistically, and the treatment is also holistic. Like when we say what is the pathophysiology, what is the miasmatic background, and how it has to be treated, we cannot revert the age, but what we can do best, that sir will be describing. So I hereby welcome Dr. Narayan Kalyani sir. Please join us and enlighten us with your Dr. Dhiraj Gupta will be inviting him. So, Dr. Dhiraj Gupta, over to you. Thank you so much.
I also not taking much time because already time 15 minutes passed. So as our speakers are already ready to tell something, first of all, as per our curriculum, I must call Dr. Akashbonti Sonowal to say about the topic, that is the cosmetology and homeopathy. I know that it's a very impressive topic, because nowadays people are getting so much type of cosmetic problem, particularly related to the, definitely it is related to the skin problem, and it is a vast chapter. But as the Dr. Akashbonti told me that she will describe the face part, and I think for the younger generation, the face is more preferable part of treatment than the other body part. So now over to the Dr. Akashbonti to start her lecture. Thank you.
Thank you. Very good evening to all of you. First of all, I want to thankful gratitude to our president of our Alumni Association, Dr. Narayan Kalyani sir, and our General Secretary, Dr. Bidyut Mukherjee sir. And also I want to pay my regards to all of my gurus, my senior and my lovely juniors. Today's my topic is cosmetology and homeopathy. The topic itself says about beauty. Beauty which brings confidence, which brings joy, and which is a main element of our life. And the derangement of beauty somehow comes, it occurs due to some internal and external factors. In internal factors, I want to share some trigger points like unhealthy life habits, like unhealthy diet, lack of exercise, and that unawareness of the products, that how to they more people don't know how to use the products, when to use the products. They don't have that proper awareness, and these are the main that causations of derangement of beauty. Next. That the cosmetology topic is a big topic. Basically, it covers like a face, hair, and all the skin part. But today, I will represent that face part. Some major problems are pimple, warts, oily greasy skin, hyperpigmentation, that dark circles around the eyes, etc. And our homeopathic treatment is a natural way of treatment, and it is a no side effects, and it brings a healthier and a natural look to one. So nowadays the people are trying to attract more about more to homeopathic treatment than other alternative methods. And because the in alternative methods there are so many side effects are there, and the recurring expenditure also there, so people are usually use the and accept homeopathic treatment. Today, I will share with you all one of my case about a pimple which is pustular type, and the patient is pimple with post-inflammatory hyperpigmentation also, and which his name is Ashwin Patel from Gujarat, and he is 22 years old, and after case taking, his present complaints like he is suffering from 4 years this type of pimple, and somehow the case is taking in 2020, but it is a very I got a very good result, so I want to represent it in my slide. Next, his family history also present. His elder sister also have the same issue like pimple, and then I take generalitis. In generalitis, his desire is chicken, sour, cold drink, appetite, and thirst. Others point are not so like general in and but I in mind, he is very oversensitive patient, and he speak hastily, and very mild, and very shy in nature, and desire to be silent, and whatever I observed, I'm after taking case, I just I totality of the symptoms. I take totality of the symptoms, and then I choose cant repertory and select a remedy, Heparin sulf 200 C. In that, after that selection of remedy, I gave him Heparin sulf 200 in globules for 15 days regularly, once daily, and I also advise him for use that the face wash, homeopathic face wash, and the homeopathic ointment uh, uh, twice daily. And I gave him advice to drink enough water and avoid any type of irritant. Wash his pimple area for in with homeopathic face wash, and avoid to touch and prick the pimple, and eat healthy diet in regular time, because these managements are very important for treating and cure a patient. Next, you can see on the left hand side the before after picture of the patient, that the patient come with this pustular type of pimple with mark of scars, open pores, and that type of hyperpigmentation area due to post acne inflammation. This photo is taken on 8 8th of May 2020. After 3 months of treatment, homeopathic treatment, see the result at 8 August 2020. And in fact, on the right hand side, after 3 years, no recurrence. And after taking feedback of the patient, I also take a video of the patient feedback, and this link is in my YouTube. I will share it after the meeting. And for today, I have that much only. Now I want to hand over my forum to Dr.
Okay,
Bidyut
thank you.
Mukherjee, sir.
Okay, thank you, Dr. Akashbonti,
Thank
for
you,
your
sir.
means within a short period, within a short time, you have gathered the a good experience and a good collection. Here,
Thank you, sir.
there is need of so many cases, because as you are taking more and more number of cases, that will be better for your means scientifically proved papers. So
Yes.
as your means, everything, the details, the case taking, we have followed everything, and definitely we will get the good opportunities whenever you are showing your that clip. Just told me that you will show the clip also. So I think your part is, I think, over. No, Vidudha.
Yes.
No? Okay.
Akashbonti, are you going to show any clip further? Patient's clip or
Yeah,
video?
at last he
Uh,
told.
yes, the link is in my YouTube only. It is in YouTube, the link.
Oh, then you cannot show. Please
Yes.
share the link on the live chat. On the live
Okay.
chat, while you connect from the YouTube. And Professor
Okay.
Dhiraj, if you can put on your camera, because only sound
Okay.
is coming.
Okay.
Okay.
So
Uh,
next, sir, shall I call to the sir, Vidudha?
yes, yes, please, please.
Okay. Okay. So now I must call to the our respected sir, Dr. D. Kalyani sir, because during our time we have taken so many experience from him, and definitely today we will also again we will have the his experience regarding the joint disease, particularly as for the topic osteoarthritis, because as per my experience, if we can treat osteoarthritis, uh, we can get so many patients, because nowadays people know that for the osteoarthritis, from the other side they are only giving the painkiller, but we people are not giving that type of pain like a painkiller. Rather than we are giving as a holistic approach. So not to take more time, now I must call to sir, Dr. D. Kalyani sir. Now over to the D. Kalyani sir.
Thank you. Many thanks to Professor Dhiraj Gupta for coming with us and giving multiple helps as a moderator. Thank you, Pritha, for inauguration. Today's topic was very nice. That is cosmetic homeopathy. Excellent topic and a burning problem nowadays, and a rising sun of homeopathy, I can tell you. A day will come when many people will tilt to homeopathic solution for cosmetic treatments. So I must request Akashbonti to get prepared with multiple cases, keep concentration more on cosmetic diseases, increase the numbers, and to present you for us and our profession. Many thanks to Prolay, Dr. Mukherjee, on and out of screen of today's CME. This is continuation of degenerative joint disease experience in NIH OPD and IPD. Today is the third phase. One thing I want to tell you that once I found that juniors are feeling sick to come before this CME with their less number of cases or less experiences, then I decided that to encourage them, we must come forward. We are simply taking time. This should be given to juniors first, because we are too old, nothing to grow more. Simply we are to encourage juniors. So being junior, please come forward, start sharing even in 1 or 2 cases. Let it be started. Gradually, one day will come when it will be expert in this system. So anyway, let us come to our subject proper, degenerative joint disease. I want to repeat few sentences again, that NIH is supposed to be, and it is, the unparalleled OPD and RPD, because NIH is supposed to treat the refused and rejected cases or so-called surgical cases, because homeopathy is living in the world till today simply for the cure of incurable, difficult, obstinate cases. Degenerative joint disease is one of them. Whole universe is suffering. It is a great problem for aged peoples. I told you about 10 millions of people every year in India suffering with degenerative joint disease. Not a matter of joke. More unfortunate is for the disease, there is neither any prevention nor any cure.
It cannot be prevented or cured. So naturally, homeopathy has
very good to deal with. Now, this degenerative joint disease can occur in anywhere, any joint. The pathology, fundamental or in brief, the pathology is wearing and tearing of joints. So naturally, more the weight bearing, more the chance of tearing and wearing of the joints are there. Naturally, knee, cervical spines, shoulder, and other weight-bearing joints are more victims of the degenerative joint disease. Among which, after a few years of clinical experiences, what I decided to concentrate on the joints who are weight bearing, who are irregular, who are small, whose symptoms comes quickly, whose changes of pictures clinically can be assessed very quickly, and if it has been neglected, very fast it aggravates and ultimately takes the patient to bed, means bedridden. Sometimes invites massive surgery, which is even life-threatening. So naturally, I try to concentrate on the spinal joints for the time being. And what I found that spinal joints before, after, and before, during, and after treatment, clinical and radiological changes are very prompt and sharp. Today, in the third phase, I like to give you some experiences regarding the osteophytic changes, which is a critical disease, which is bone growth disease, otherwise called as spars, bone spars. Means like bird's beak, it grows on projecting with an irregular pointed shape. It does not usually create any complaints, symptoms, but once it gives some mechanical pressure on some important organs, like membranes of the joints, nerves, other important organs, then accordingly it starts giving pain of that area and goes on progressing because there is no chance of prevention or cure as per present therapeutic system is available in the world except homeopathy. And what we have seen in NIH OPD, we are confident to cure those cases. Regression of osteophytes has been observed in radiology that has been certified by some expert radiologist, Dr. Brigadier, Colonel Nondi. You might be knowing him very well in our OPD radiology department and other radiologists from outside. So this regression or normalization of osteophytes is a great success for our system because incurable or uncontrollable cases can be cured by homeopathic medicine by very minimum dosage, minimum expenditure, minimum trace. And we're astonished to know that even without any accessory physical medicinal help, that in some cases can be cured without any physiotherapy that has been observed. So let us go to a little bit of pathology of spars, means osteophytes. This is the first picture. It is collected picture. What we are finding that these vertebrae, lumbar vertebrae, the first intervertebral disc is normal, top one. Then the second, a bit narrowed. I told you last time that in the lumbar spine, gradually thickness of the intervertebral disc will increase because more the pressure, more the buffering system is necessary. Naturally, in comparison to the T12 and L1 or L1 and L2, L4 and L5 will be thicker. In this picture, we are seeing exactly reverse. Upper intervertebral discs are thick, then slight thin, then very thin, then very thin. That means this wasting of cartilages. What is happening? This is one disease. Last CME we have discussed regarding the degeneration of cartilages. Now here they are finding that due to thinning of the intervertebral cartilages, the bone edges are almost under friction. And that friction is resulting to irritation of the bone, exacerbation of the calcification, and we are seeing the sparring of bone spars. As it has been marked by arrow, bones are projected out, resulting to maybe slip disc, maybe compression of the nerve roots, which are supposed to be come out between the vertebrae freely, that is under compression due to this osteophytic irritations in the dorsal side. This is the first picture. Then let us see how it looks in X-ray. This is another lumbar vertebra. see the 1, 2, 3, 4, 5. See how, like Bart's beak, the osteophytes are progressing. I think it is clear to you. These are the projected points. And obviously, it is irritating the anterior organs at the same time, causing friction between, and gradually this is reducing. This has been reduced much. Next picture. This is another colorful picture. See, bone overgrowth, compressing spinal disc, smooth bone edges, and irregular bony edges. For the irregular bony edges, compression of the intervertebral disc, resulting to irritation of the organ and adjacent tissue. Here is another sparring very common in the calcaneus. This is called as calcaneus spar. Sometimes it happens in completely extreme gravitational points just below the heel. Sometimes it grows behind the calcaneus. This sparring is very much irritating because the entire body weight is supposed to be on that point. Naturally, patient first start difficulty and pain in walking, then gradually the adjacent areas including plantar aponeurosis will be affected. Whole shoulder will be painful, unable to walk. Ultimately, he needs operation or osteophytectomy. Now, when osteophytectomy is done, no orthopedic surgeon will give you assurance that there will be no chance of further growth or further production of these osteophytes. Or these osteophytes will never develop anywhere in your body. Because the cause behind these osteophytic changes are various. And the first CME and degenerative joint disease I have shown you, there are multifarious causes, starting from hormone, enzymes, vitamins, mechanical causes, habitats, many other things, body weight, etc., etc., etc. Everything were detailed discussed. So any of the causes may cause this sparring. So simply operation will reduce the growth for the time being, but can never give any assurance that there will be no recurrence because all the causes remain still constant in spite of any operation. Here is the another part. Just see the heel spar in the dorsal portion and the entire calcaneus bone, dorsal, below, and towards anterior side, there is sparring. This pointing sparring is directly giving pressure on plantar aponeurosis. So, severe pain for movements. Here is another picture, spinal bone spars. See how the intervertebral borders has become irregular by calcaneus spar growths, osteophytic growths. How the spinal joints are also getting osteophytic growths. This is cervical spine. See the picture. Almost it is going to be a bamboo stick like spine. Almost all the vertebrae has osteophytes in frontal side. Very much important organs usually passes through this. Not only that, for the osteophytic growths, if vertebrae get dislodged, I will tell you in the next subject, subluxation, then that will directly give pressure on the spinal root nerves, maybe in the central canal, maybe in the vertebral artery, which is supposed to pass through the lateral halls of the cervical spine and will ultimately go to the circle of Willis, which will supply the cerebellum, who maintains our body equilibrium. So this sparring, inability of normal movements are restricted, leads to frequent vertigo, pain in extremities, pain in neck, discomfort, irritation due to deficiency in oxygen due to vertebral artery blockage or distortion root of the vertebral artery, or infrequent postural vertigo because hypoxic effect of the cerebellum due to distortion or compression of the vertebral arteries. Many multifarious complex. Everything depends where at the spar, how many are there, how long they are persisting, how the other factors are being maintained. This is sparring of the knee joint. See here, tibia, fibula, the apposed area. Usually sparring is between the bone, border of the joint or apposed bones, except few areas like calcaneus and other. So this fixed area has become osteophytic, naturally creating pressure on the synovial membrane, joint sac, adjacent tissue, gradually pain, discomfort, inflammation, swelling, and sometimes may lead to secondary infection by through blood. So various types of complaints gradually patients get unable to walk. Dr. Dhiraj Gupta has told you that this is aging problem. Age is not only the factor, there are multifarious factors. Plus, age is a great factor. Usually, this is rare in young. Here is another. The points has been shown by the arrows. Patella is osteophytic. Femur is osteophytic. Tibia, fibula, all the bone edges of the knee joints are osteophytic. Just imagine the complaint and discomfort of the patient. Here is another picture of cervical spine. See, first, second, third. Third has become so much osteophytic, third and fourth. Fifth, sixth, seventh, almost they have been fused by the osteophytic changes and coalescence between them. So just imagine how restricted has become his neck movement. It doesn't matter. But it doesn't matter means life-threatening complaint is not there, but persistent complaints on the posterior pharyngeal wall, persistent complaints of the vertigo due to insufficient oxygen supply, hypoxic effect of the cerebellum by the vertebral artery because it has been distorted by this distorted movement, distorted appearance of the cervical spine. So these are the few common pictures where we have seen how they look like and what happens then. I told you before that the first complaint, beginning complaint of these diseases is occasional restriction of the area, occasional pain, weakness, intolerance of overstrain. These are the early pictures. If we are not careful in the beginning, obviously these osteopathic changes are going on progressing and ultimately the patient is bound to become a chronic permanent patient of degenerative joint disease. One paper was produced and it was produced for publication, but yet to be published in NIH. That is the regression of osteophytes by homeopathy. Abstract was documented fragments of ongoing research project of joint diseases, projecting radiological cure of osteophytic changes by homeopathy. This article will project cure of 9 cases of osteophytic changes by ideal homeopathic treatment. Here we will see 9 cases, and in the next CME or the CME after next, we will see another 5 cases. Total 14 cases NIH OPD will present you. Documentary cure means radiology staining osteophytes are completely cured without any recurrence, without any reappearance, or without any other complications. These are the keywords, formalities. This is one information for all of you that OPT cases of neck pain and low back pain were under clinical and radiological trial. X-ray of concerned spine was one of the compulsory inclusive criteria. During the course of research, many encouraging clinical and radiological changes have been observed. 90% of cases with progressive bony changes could be arrested with complete symptomatic relief. That is one of the greatest information. Maybe we could not completely cure all the osteopathic changes because our lacuna, our limitation of knowledge, we could not find the exact drug. But it is obvious that majority of the cases, the growth was completely arrested. It was documented by follow-up radiological study. Only the cases were cured has been shown here. All the documented records were presented in the National Institute of Homoeopathy, which was published in annual reports and bulletins. Now, this 90% arrest of all the osteopathic cases, it tells us that 100% can be arrested if exact drug is selected. You know very well that all the time the exact drug selection is not very easy. And in our OPD, NIH OPD, you know the rush, you know the hurriedness, you know the number of cases where these things are a constraints. And as because we don't have the exact research infrastructure, we could not consider especially to all the cases with equal importance. Few cases, radiological regression was observed. Among radiological improvements, number one, in 23 cases, regeneration of intervertebral disc degeneration was observed. Abolition of serpent articular fasciitis was observed in 10 cases. That has been given during that time when it was produced. Cure of subluxation was observed on 9 cases. Osteosclerosis was of 6 cases. I will show you later on in subsequent CMEs. Abolition of osteophytes was observed in 9 cases, which is presenting now today. Complete radiological cure of spondylosis was found in 16 cases. This number is much more. That also I will show you later on. Aims and objects was preliminary. The project was to observe the effect of homeopathic medicines on orthopedic disorders, to study whether our medicines are able to give short time or long time relief, to study synchronous changes in clinical, radiological, and laboratory data, to study the effect of homeopathic medicines in cases of nutritional, metabolic, traumatic, and iatrogenic hazards, complications, and adverse reactions, to observe the suitability of administration of homeopathic medicines to various stages, degree, type of orthopedic disorders, to examine important of quality of life of patients suffering from joint or bone diseases, to establish evaluatory approach of homeopathic therapeutics in orthopedic disorders. One more thing I want to inform you that surprisingly it was observed that as it is told in conventional system of medicine, that calcium, vitamin C, vitamin D is compulsory for management of the osteopathic changes or degenerative joint disease. We have observed that without any management, without any dietary advices, patients also improves and some patients gets cure of the orthopedic disorders. Why I concluded, you know very well, all the alumni of NIH, that NIH outpatient departments, the patients are not of that much economically sound, not are that much intellectually sound. Very simple people, majority from the villages. So they cannot maintain the instruction of the doctor, or they are not that much sincere to continue the instruction of the doctors. Obviously, we tell the patients, but patients are telling that I don't have much money to come to OPD for treatment with 5 rupees. How can I afford milk for vitamin and calcium? In our family, only babies are given milk. No one takes milk. This is the situation of the family members. So the advice of taking rest, other necessary means, physical exertions, diets is practically was not possible by our OPD patient. They are also found there are striking improvements, which is very, very much encouraging. So why I want to tell you all these things that with or without accessory measures, if we take our homeopathic measures, proper case taking, evaluation, repertorization, consultation of Medica, and then selection of the drugs, obviously we can treat the patient very successfully and sometimes beyond your expectation. Methodology was very conventional, same procedure. Now discussion and final, this I want to tell you. Discussion on the final assessment. It can be claimed that joint diseases in a global problem is a global problem of elderly people's overuse, unuse, disuse of joints movement with or without hypocalcemia and overweight. Sedentary peoples are more victims of joint disease. All patients were collected from OPD and registered in research department after confirming the case from radiological report. Here I want to tell you, brothers and sisters, that maybe so like me, you don't have any means, any infrastructure. But what we did, we used to request our OPD card makers, those who are registering cards in the registration counter, we request them, you brothers, I am specially dealing with some bone disease or some cosmetic disease, or I am interested in such a disease. Whenever you get this type of complaints, please send to me. They'll be very happy to select the patient from OPD without any instruction from higher authority. They will ask the patient, what is your complaint? When they will select the cubicles. Once they will tell the complaints which I want for, immediately they will go to that cubicle. By this way, we collect a number of patients, few hundreds. So this is my request. If you do not have the means, infrastructure, please try to collect the patients. Tell your friends, your fellow mates, your colleague doctors, or in your hospital workers that this type of cases I have special interest, I am dealing with it. If you are not able to cure, please refer me. I am tracking trials of so many cases. Everybody will help you. Department, after confirming the case from the radiological reports, all the cases were first started the radiological reports. Clinical and radiological trials were considered in the project. Hence, clinical and radiological follow-up was done simultaneously. Clinical aspects I am not showing, it has been displayed before in the first CME. Simply today I will show you the radiological improvements. Serological improvements were not considered because of the deficiency of means of serological studies. You know very well that our pathological department and other departments are limited in the field of homeopathy. Majority of the patients' pain started improving within 15 to 20 days. Just imagine, a patient suffering from few years had treatment in different places. We have seen minimum period is 15 to 20 days. Not that all the patients are getting within 15 to 20 days, but minimum is within 2 weeks we'll feel the improvement if the drug is selected correctly. Radiological improvement was found much later of clinical improvements. Progress of deterioration could be arrested to 95% of all cases. This is confirmed by number of cases that if you cannot improve radiologically, if you cannot much improve the severe clinical complex, but it is obvious if you are nearest to the constitutional or symptomatic treatment, if you are exact in the invasive treatment procedure, the progression is obviously can be restricted. All of you have experienced that there are many patients who are telling that no improvement, no improvement. You ask him, is there any deterioration of your complaints? Then he says, no, no deterioration, but no change, no improvement. It means the drugs or the disease is not compatible at this moment, but the medicine was completely successful to arrest the progress of the pathology. So stick to the drug. Think the adjacent drugs as complementary or the constitutional mathematics. Even in the process, and patient will be definitely improved. Don't leave patients. Progress of deterioration could be arrested to 95% of all cases. Minimum time taken for radiological cure for the presented case is 7 months. Just imagine, within 7 months, the radiological cure is being observed, who is suffering from years together. You know very well that patient of NIH is not coming as fresh. They are coming from multiple hands after getting treatment in the locality by multiple doctors when they doesn't get cure or improvement. Then only they come by taking much strain to NIH OPD and they stand on the queue since early morning and goes back to home at late night. Minimum time taken for radiological cure is 36 months. Sorry, maximum. Minimum, I told you, maximum time taken radiological cure is 36 months. Minimum number of visits in NIH OPD was 3 and maximum number was 17. So it is evident that by 3 visits only, by 3 into 5 rupees, 15 rupees, there is documents that osteopathic change can be regressed to normal. Late middle-aged Hindu patients are more victims than others. Cause is not exactly known. This is my assumption. I may be 100% wrong that this protein deficiency, along with minerals and vitamins, are usually taken less by Hindu peoples. Whatever, it is subject to be thorough research. This is simply as per statistical data available in our case records. Potency of selected medicines were 200 to 10 m, follow-up treatment and new cases registered are still being carried out. That was an intermittent report. That means this was being continued. Joint disease, which affects almost every countryman, was taken into consideration as an international research project to fulfill one of these aims and objects of NIH, that is research. Our claim at the beginning was to achieve better living of orthopedic patients, but homeopathic treatment, interestingly, it was found in due course of time that homeopathy not only gives a better life, but clinically better life and clinical improvement, but also can radiologically cure many types of joint diseases after an exhaustive study of few years in NIH. Most of the projects claims for the project has become successful. Main object of this project to prove this claim that homeopathy is better means of treatment for joint diseases. Following achievements will justify our claims. Most of the patients came to us being radiologically diagnosed and under modern treatment. Their expectation was to curtail or stop taking modern medicines, allopathic drugs, and to avoid operative measures. for many long periods. Almost all patients were able to withdraw modern medicine. This is another striking improvement. That is, they were able to withdraw their conventional, regular drug taking means painkiller, etc., etc., modern medicines, and were able to avoid operative and post-operative hazards. No further deterioration was noticed during the course of homeopathic treatment. Existing status of ability was improved by homeopathic treatment. Many associated complaints and diseases were remained during treatment. Complaints and diseases were removed during treatment. This is another achievement by homeopathic treatment. If you go for treatment of degenerative joint disease, if the patient has a chronic gastritis, that will be cured, guaranteed. If you go for treatment of degenerative joint disease, that is a chronic disease, you are bound to take the total case history. A patient having a tumor in the back, unnoticed or noticed, automatically getting cured. You will see a number of cases. So homeopathy is a treatment in the universe, I can tell you, that is one treatment for many diseases in a person. If a person having 20 diseases, we go and ask you, what are the complaints? What are the presenting complaints? 1, 2, 3, 4, 5, 6. It may so happen that 6 complaints belong to 6 systems, but our medicine is one. Treatment is one, that is homeopathy. Such type of beauty of therapeutic system is not available anywhere except homeopathy. Many times you will even see that presenting complaint for which patient came to you, that is remaining still, unchanged, unmoved, neither improvement nor deterioration, but other complaints are gradually vanishing. That is another sign of homeopathic treatment and improvement. By removed during treatment, there are obstacles to achieve best possible outcome as research infrastructure of NIH is not very pure. All this presentation what I am presenting by your help simply to encourage all of you that please start. Keep records, documents, produce before anywhere you get the chance. That will not only increase your confidence, but also it will increase our confidence too. All of our will go to improve our confidence and achievements. This is another interesting thing. The 9 cases that we will see today, master chart. As all the time we, South and NIH teaches all the students, UG and PG, that person is one, drug is one, you have to search it out only. See, the first case, it has been mentioned, serial number, research registration number, OPD registration number, name, age, sex, religion, duration of treatment, from to, period taken, months, how many months period taken for radiological cure, number of visits, the drug, remarks. First case, Mrs. CS, whatever, C, period was 24 months. Number of visits was 17, drug was lycopodium clavitum. Next, 29, only 3 visits. Drug was Rastox. Just the minimum, only 3 visits. Because he was in a long gap. Then your next patient, 11 visits, drug was Rastox. Longest period, 36 months. Next, 22 months, 10 visits, calcarea flow. 17 months, 14 visits, hypericum. 7 months, 4 visits, hypericum. Shortest period, 9 months for complete radiological cure of osteophytes. 9 months, 10 visits, silicea. 7 months, 4 visits, radium bromide. Shortest period, 7 months. 18 months, 11 visits, hypericum. So, by seeing the drugs, we can assume maybe some commonly mentioned drug is available, but no patient is similar to others. Now these are the references, formalities. Now let us come to the documents. Case number 1. These are the before treatment cervical spine. Clearly you are observing the osteophytic changes here. Let us see the reports. Second line, marginal osteophytes noted. Cervical spine. Loss of lordosis, marginal osteophytic changes. After treatment. See, this lateral view, osteophytic changes are reduced. That was from outside. This was the report from our hospital. No osteophytic changes. There are other changes still persisting, but osteophytic changes are varies. Case number 1. Case number 2. Lumbar spine. There are osteophytic changes. In this line. No osteophytic changes. Few other changes are there still, but osteophytic has vanished. Case number 3, lumbar spine. It is underlined there. Anterior osteophytic leaping, L3, L4. After treatment, no osteophytic changes. Oh, sorry. That was gross osteophytic changes. Now it has become marginal osteophytic changes. Next report. Lumbar spine. Oh, sorry. Very sorry. Before treatment, after treatment. This is another report. Marginal osteophytes. That means serpent osteophytes or big osteophytes has become marginal. That means it's on the way of complete evolution. All the data points are given here. Slowly you can observe. This is another document. Case number 4. Here is osteophytic changes from L2 to L3. Osteophytes. Lumbar spine. No osteophytes. Case number 5. osteophytes from L2 to L4. No osteophytes. Report for outside. Osteophytic changes, cervical spine. After treatment in a hospital, normal study. No osteophytic changes, no other osteophytic changes, completely normal. One more thing I want to tell you. If I get a chance in near future, I will show you calcaneus bar, which is the biggest osteophytes and most troublesome, can be safely cured and completely regressed by homeopathy or medicine. Today, the subject is different. That's why I'm not showing those osteophytes. Simply the presented documents. It is another case of osteophytes, clearly visible here. After treatment, no osteophytes. Case number 8, lumbar spine. You are seeing with osteophytes, there are a number of radiological changes. But because we are talking today with only osteophytes, simply where I am trying to show you osteophytic changes, no other changes. That will be shown later on. Case number 8, osteophytic changes, second line. Lumbar spine. Here there is 2 reports, but simply concentrating on the lumbar spine, there is no osteophytic changes. Last case for the day, case number 9. There is osteophytic changes, second line. After treatment, no osteophytic changes. So these are regarding osteophytic changes. Bidyut, can we continue today? We are having time now. Bidyut? Okay, we are having time. Let us talk about something, subluxation.
Yes, sir.
We continue.
Dr. Dhiraj, Professor Dhiraj, if you permit, we can continue further. Dhiraj, can you hear us? Dr. Dhiraj?
Yes, sir. Yes, Dada. Sir,
Any
sir is talking.
That is,
Hello.
so please continue.
Hello.
There has been a
Yes.
Dhiraj, yes, please. Thank you. Thank you, Dr. Dhiraj.
Okay. Thank you very much. So, brothers and
So
sisters,
there is a
let us
question. So
yes,
there is a
please
question from Dr. Pritha. Kalyani sir, please share the details where the article has been published.
Article has been deposited in NIH library registration for publication, but it is yet to be published. We can send this document to our e-journal for publication. It has not yet been published anywhere.
Okay.
Okay. Thank you, sir.
So because
Please continue, sir.
So because we are having time, let us see how subluxation can be cured by homeopathic medicine. Now, what is it? What is subluxation? It is a dangerous disease. It is slipping of vertebra from its axis. I told you before that cervical spine is supposed to be anteriorly convex, posteriorly concave. That means normal lordosis is curved. And this curvature helps the vertebral artery to pass on freely. And this curvature also helps in different type of movements to divert the center of gravity of the head, heavier head, in such a manner by which chance of injury is very less. That is why spine has been made by the Almighty as snake-like, not straight like bamboos. So you see this plate, salvage's spine has become straightened as if a rod, which is abnormal, not anatomical. Why? Because see these red arrows, this slipping of this fifth vertebra has slipped out, sixth towards back, fifth is a bit center anteriorly. So this slipping is a dangerous disease. Cause may be anything, as we call common cause of degenerative joint disease, vitamin deficiency, hormonal deficiency, parasite disorder, diseases, then diet habits disorder, body weight, overstrain, unused, disused, overuse, whatever may be the cause. Number of causes are there. But the ultimate pathology is the vertebra is one vertebra is dislodging from its axis, creating not only compression on the nerve roots, but also pressure and compression of the central canal, spinal cord. It is creating difficulty in normal axis, normal anatomy of the vertebral artery, and it is irritating the adjoining tissues, ligaments, etc. to create discomfort, pain, and other things. And if these things are not been arrested, controlled quickly, it is inviting a severe surgery. This is said to be not controllable, not curable, simply manageable by giving neck thrust, exercises, this and that. It can be controlled to improve their lifestyle, but can never be cured, as per the conventional system of medicine observed. But we have observed in our opinion that these things can completely be cured, whatever may be the cause. We see we do not concentrate on the physical causes of the patient or the disease more. We concentrate more on the miasmatic causes, means the cause before the causes. Means why the mineral and other vitamin, etc., hormones and other things are getting insufficient or becoming non-physiological. That cause is our target. That is miasm, fundamental cause. But secondary causes, which is said to be the cause of the disease, usually we do not give much value except management. So whatever may be the cause, if this happens, so dislodgement of the vertebra from the axis is a dangerous disease. It is neither preventable nor curable, but it is curable by homeopathy. I will show you the documents. Let us see a few pictures, which is encourage us. Primarily, he will complete on the pain. Then gradually the pain will increase. Ultimately, if you ask the patient to cough by sitting erect, by keeping the spine straight, he will experience either girdle pain or root pain. I told you before. Girdle pain is once patient coughs by keeping the vertebral column straight or erect, not straight, I should say, erect, then there will be ring-like or band-like pain, sharp pain, stabbing pain from back to abdomen. Sudden pain by the coughing impulse. That is called root pain. Sorry, that is called girdle pain. Cough, tremendous pain across along the course of the nerve up to the abdomen and to the abdominal wall. Sudden sharp stabbing pain is called girdle pain. And the patient, if start pain only on the affected area, patient is coughing and asking that this is the point where I am getting, as the patient is swaying. Sir, this area I am getting pain due to cough. Get the X-ray, you will find subluxation has been happening there in lumbar spine. This is a picture of subluxation. See this. The nerve fibers are coming between the vertebrae. If there is subluxation slipping out of the vertebral from its axis, automatically it will drag the whole system anteriorly or towards the subluxation. And for that dragging, there will be root pain, girdle pain, continuous pain, movement disorder, unable to sleep, unable to normal movement, etc., etc. This is another picture of cervical subluxation. See the vertebra has become straightened. Third, fourth vertebra. First and second there is subluxation. Third, fourth, fifth and sixth there is subluxation. Fifth and sixth there is subluxation. So disc injury. Due to subluxation, the discs are getting injured, becoming thinner. As I told before, that gradually thickness of the disc are supposed to be increased. But in this picture, we are seeing that the disc between 2 and 3 is more. 3 and 4, almost same. 4 and 5, thinner. 5 and 6, more thinner. 6 and 7, thinner. So this thinning of the vertebral cartilage than that of its normal thickness is a sign of subluxation. Vertebrae is slipping out of its axis, resulting to different types of compressions. Lumbar subluxation is less serious, less dangerous than cervical subluxation, because cervical spine is supposed to carry important structures not only from the hands but also from the whole body. Lumbar spine is supposed to carry the nerves of lower extremities and lower abdomen, but the cervical spine is such a place where nerves are from all over the body and very vital arteries, vertebral arteries passing laterally along with the vertebra. So this is a very much sensitive area and equally serious too. There are 5 main components to the vertebral subluxation complex: neuropathology, abnormal nerve function. Number 2, kinesiopathology, abnormal movement, as I told you, that overuse, disuse, and unuse. Myopathology, abnormal muscle function. Myopathy, CPK high, or any other type of myopathy. Histopathology, tissue abnormalities, any sort of neoplastic, benign or malignant. Pathophysiology, pathoanatomical changes due to uncorrelated subluxation. Here is another sign of subluxation of vertebral artery. Sorry, cervical artery, cervical vertebra. This is a picture of pain in the lumbar subluxation. This is proper alignment. This is a nice picture. You see, lumbar vertebra is supposed to have this side of curvature, then with convexity forward, concavity backward. This is normal structure. This lordosis is, if it is lost, there is vertebral disease. And see this vertebra, sacrum and fifth. So there is this vertebra slipping out. Offset arrangements. This is normal arrangement. This is abnormal arrangement. This axis was supposed to be in this line. This has come down here. So this is another good picture of subluxation. These are the different supplies of the intervertebral foramens. The symptoms and complaints will come according to the area of subluxation. See the mystery starting from the eye to the urination, rectum. Many organs are involved in this system. This is another picture of simply picture of subluxation. The osteopathic cases are there. This is another sign. Pictorial presentation of, see the lower vertebra is being compressed. This, as I told you, this subluxation will cause neck pain, disc bulge, neurocompression means nerve compression, joint misalignments, spinal decay, muscle spasm reactions. These are the different causes. You can see it later on, different supplies and how subluxation will affect the body by producing different types of symptoms of different levels. This is another good picture. See how the nerve roots are being compressed, how the disc space is bulging out, how the vertebra, this vertebra has been dislodged. This is a serious case, though it is colorful pictorial presentation, but this type of situation invites immediate surgical interference. This is another picture of subluxation facet. There is two pictures, normal, subluxation. In the vertebral disc, vertebral alignments are normal in this picture left side, right one, it has been slipped out. Okay. Now this is brief of picture presentation. Now we will go to documentations. We'll present here 6 cases of subluxation. That means 6 into 6 reports. 2 acceptance, dorsal ventral, epilateral, 1 report. Before treatment, after treatment, that means total 6 reports for one patient. 6 patient means 36 reports we'll see here. We have to be a little bit hurry because time is ahead. Maybe you are getting tired too by seeing the report. This is the AP view of the lumbar spine. This is lateral view. Are you seeing this subluxation? This vertebra slipping out and the axis has become distorted. See the report. Subluxation. Clear? Anterior subluxation. Here is the lumbar view. This is clearly visible from anterior view also. Lateral view. No subluxation. Subluxation. No subluxation. Posterior subluxation is fine. L5S1. After treatment, no subluxation. In this case, it is also lumbar. Posterior subluxation, L5S1. Why am I insisting you to keep documentation? Because these reports, pathological, sonological, radiological, whatever it is, all the reports are certified and signed by the specialist. So once you cure a case, means those specialists are telling that yes, your system is able to cure. Not that you are telling the case has been cured. That is why please go on keeping documents. Lumbar, posterior subluxation of L5S1. L5S1 subluxation is very common. because the maximum weight bearing area is lumbosacral joint. That is why, and our movements are also maximum in the lumbosacral area and cervical spine, means C1 to occipital bones. Naturally, this area subluxation is common. Next case, lumbar spine, and subluxation of lumbar spine is also very common. No subluxation. Subluxation of L5H1. Normal study. Not only subluxation has been cured, all other components of cervical lumbar spine has been cured radiologically. Certified by Dr. T.P. Nundi, our respected radiologist. So, regarding treatment, I want to tell you a little bit. That is, whenever patient asks you that, will I get relief from the pain? Tell him immediately that, wait, let me take the history, then I will tell you. Take the history, select the drug according to our procedure, exact procedure, means case taking, evaluation, repertoration, mathematical consultation, and the drug. Then you ask direct question of the drug, especially mental or physical general, which is not present in the picture, case history. Means you have taken case history in details, but ultimately you came to know that patient is of natural. One patient is not there, you did ask that, do you feel fresh when you are in empty stomach? You took the case history, next time is confirming your case taking, reparation, evaluation. Then you ask directly question, sir or madam, can you tell me one thing? When you feel more fresh in empty stomach or full meal or after taking food? If the patient tells, yes sir, I feel much better when I am in empty stomach, then be confirmed that your medicine is 100% confirmed. Sure. That means to confirm your drug, ask mental or physical general symptoms directly to the patient after your conclusion of the Medica. If you get that, then you tell the patient, reply, obviously you'll be relief of your complaints. Not only that, you'll be relief of your presenting complaint for which you have come to us. You'll be relief of your other complaints, as you told me, 6, 7, 9 complaints. That will also go gradually in the reverse of order of the Hering's law of cure. The last complaint will go first. You will feel fresh. Appetite, sleep, freshness will come first. Exactly direction you can give when you are confirmed about your drug. And patient will follow the instruction. First, he will feel the last complaint has been abolished. He is feeling fresh. Appetite is good. Sleep is good. He will be happy that what doctor is a force here. What he has told, exactly the things is happening in his body. He will give you time, months together, years together, if your guideline is correct. So whenever a patient will ask regarding confidence of the treatment, be confirm your prescription, then you go on dealing with the case. As it was told that just now it came in mind that it was asked that, how did you feel in Chicago Dharma Mahasammelan by the speech of Swami Vivekananda? The one is Western philosopher, he told that it was as if a cat is playing with mouses. So once you are sure of the mathematical drug, you can play with the patient, you can play with the disease, you can play with the family members like mouses. Whatever you will tell, that will happen. Within 7, 20, 15 days, your complaints will go up. This complaint will go first, then this will go, then that will go, then your movement will increase, then your ability will increase, then ultimately it will be completely normal. But remember, as I experienced, that I want to tell you, tell the patient that your complaints will go much earlier within a very short period, but never stop the treatment, because recovery and cure is not the same. Getting free from the complaints does not mean, that never mean you are cured. Until X-ray reports are getting normal, you are getting normal X-ray report, you have to continue treatment. In spite of that, you are no complaint, you are completely fresh, other complaints have gone. Still, you have to continue treatment because you want to avoid recurrence and affection of other joints. What is very much deficient in our OPD, as I told you, the status of the patients when they get relief of their complaints, presenting complaints, then usually they don't turn back to confirm you that radiologically or sonologically or hematologically this has been cured. That's it is difficult unless there is a definite project under some financial bindings or other privileges. Patients usually do not report. But your sincerity, your foreseeingness, your instructions, your advices, your guidelines definitely will increase the confidence of the patient and they will help up to the level best. So please, brothers and sisters, go on keeping documentations. This was for the day. Thank you very much for listening. And any question, I can help you. Thank you all.
So there is a question on the screen. So there is a question on the screen.
Can you read it out, please?
Sir, was only homeopathy medicines were given or any physiotherapy, postural correction, supplements, etc. given in case of subluxation?
That I just told short this before that primarily I had the conception that physiotherapy or physical medicine is a must. As literature says. But I decided that can we not try a trial that without any, because what I experienced that majority of the patients are not listening. When you ask the patient, are you doing exercise? No, Dr. Babu, I'm telling Bengali. When I will do? All the day I'm busy, I have to go to the field, this and that. Children, don't you take much exercise? I do occasionally. Can you show me what you are doing? So he is showing the exercise advice. He is doing whatever he likes. He is not at all he is following the instruction of the either physiotherapist or my advice. But the patient is curious. But the patient is giving radiological cures. Then I decided probably this physical medicine physiotherapy is not a must for the sake of journalism. I homeopathic journalism, and I started trying not to tell anything about physical measures because they won't listen. Majority of them they will not obey your instructions. So let them do whatever they like. When they're the same, they will take automatically rest. I experienced that physical medicine is not a must in homeopathic. You can take a trial and you will have this experience like me too. If there is physical medicinal help, it is good. It will maybe it will accelerate the improvement, but it's never a must. That I have confirmed by experience.
Thank you, sir. I'm waiting for our moderator. Sir, he got disconnected. There is another question. I think this question is for Dr. Akashbonti. What are the influence?
This is like you add one thing. But brothers and sisters,
yes, sir.
We must tell that because we want our best cure, whether clinical or radiological. We must advise. In our private clinical practice, many of the patients they will listen to you. You ask the patients to have physiotherapy, physical medicine that will accelerate the improvement. Definitely, it's very much helpful. But I have experienced it is not a must. That is one thing. Okay, that means if patient is not taking any physiotherapy, not listening to advice regarding physical medicine, don't be discouraged. Go on giving your effort. Thank you very
much. So the next question is for Dr. Akashbonti. It's on the screen. What are the influence of homeopathic cosmetic preparations over market available professional cosmetic preparations? Influence of homeopathic cosmetic preparations over market available professional cosmetic preparations. And second was, what are the roles of cosmetic treatment in relationship to plastic surgery? I'm waiting for Dr. Dhiraj to join. Dr. Akashbonti, it's your question.
Yes, sir. I'm little bit confused. Means first question is what actually want to ask, like influence of
Right.
homeopathic. I'm not getting
Cosmetic
properly.
preparations. Yeah, I think with permission from Kalyani sir, uh, yeah, I'm trying to answer this question first one. Being in the
Sure, sure.
professional field
This
on the
is a very
marketing
first.
for several years,
Sure, please.
there are two types of cosmetic preparations in the market. One is the cosmetic setup. Dr. Dhiraj is here. Our
Yes,
moderator sir is here. If you
Yes, sir.
please put on the means your video, turn on the
Yes, sir.
video, please, and Dr. Pritha too.
Okay.
So the question from Dr. Praveen Majumdar is, what are the influence of homeopathic cosmetic preparations over market available professional cosmetic preparations? So from the marketing perspective, it shows now major cosmetic industry are taking benefits of the Ayush system, and the major market players in the antiseptic cream, in the face wash and others, all are trying to go for a Ayush so that they can get the benefits of the tax and the alcohol exemption rules. So that is one thing. The other thing is the homeopathic cosmetic preparation, the homeopathic external applications done by various marketing companies, various homeopathic manufacturers, which is having a greater impact. I'm not arguing on anything about the homeopathic principle on the external applications. That I leave it on to our moderator tonight, our Professor Dhiraj. But the homeopathic preparations of the cosmetics are having much better impact on the skin than the other synthetic preparations. That's point one. And question two was, what are the roles of cosmetic treatment in relationship to plastic surgery? I think, Dr. Majumdar, this is not under our preview at this juncture. Plastic surgery is a different ball game altogether. It's in the preview of surgery, neither any pathy. So it's preferred not to discuss over here on this. Now over to the Professor Dhiraj for your moderations. Professor Dhiraj got disconnected once again. Oh.
Sir,
Uh,
if you permit, I would
he's
like
back.
to.
Yeah, yeah, please, please.
Sir, about the second question, what are the roles of cosmetic treatment in relation to plastic surgery? The case which Dr. Akashbonti had shown about the acne as well as the scarring. So if there is a lot of scarring, and so people do go for plastic surgery for the skin grafting and all, whereas the case which she has shared has shown that how the skin has been cleared, and the even the scar marks have also gone. So, in relation to the cosmetic treatment, the plastic surgery, so I believe if we get more of such cases, so we can very well say that the homeopathic treatment with respect to that cosmetic value, and the at certain places the plastic surgery can be avoided. I had also come across a, thesis wherein the burn scars has been treated by homeopathy, and the that was in Safdarjung Hospital. The dermatologist and the burn department HOD, he appreciated that a lot. So for the second question, I believe that if we explore this area more, so definitely plastic surgery and the cost of getting all this can be much more reduced. Thank you so much.
Excellent, excellent. Thank you, Dr. Pritha, for your inputs. Now over to Professor Dhiraj. Dr. Dhiraj, can you hear us?
Yes, yes. Are you talking about the cosmetic, the last question?
No, no. Your moderation on the total session.
Okay, okay. Regarding the first session, I think I told that it was a nice presentation. And regarding the second presentation by the sir, sir has told very nicely because he has choose the topic, but very particular because that's a spinal problem or the lumbar or particularly vertebral problem. Because nowadays it is coming under the lifestyle disorder, and people, particularly after the COVID, once the COVID started, people were staying at their home, and people are not moving so much. So for that things, that topic from the sir is very particular, and it is very helpful because people are getting complaint related to bone backache, related to the pain in the cervical spine or more. And as per the sir, the measure, that is the radiological findings, that is also very particular because people can believe that yes, there is some changes, because whenever we are treating a patient, and whenever after treating the patient we are showing to our society, people told they are telling that on what things you have prescribed, and sometimes we can explain as well as sometimes we can't explain also. But once we are showing the radiological finding that this was the changes, and now this has been changed to the normal, likely to be a normal condition. So that is very important, and they're very fruitful. And one thing, sir, I wanted to say, because I think every time whenever we are going for the any seminar or any workshop or any online discussion, people, particularly we people are the maximum are the practitioners. They wanted to know the exact that what medicine we prescribe. And definitely, sir told that yes, we have to depend upon the case taking. If once the case taking is proper, definitely your selection will be a proper. Still, people want some peculiarity so that we can prescribe, because many literature since morning I am going through, everybody is telling that the very common medicines, and like Brahmi, like that. But still, after going through that those papers, I wanted, it's my own experience that what about the our nosode, and what about our the imponderabilia medicine which is coming under the imponderabilia and the nosode? Is it helpful? Just I'm throwing the question to the session, and even to the my sir, Dr. D. Kalyani sir. For example, just I'm giving example also. For example, the medicine is X-ray, and how to prescribe X-ray? Because whenever we are going through the literature of X-ray, we are coming to know that yes, the people those are working in X-ray department, they are preferably can be prescribed. Second part, nowadays people are very eager to do the X-ray. Whenever any problem, they are telling that even the not the patient only, but their friends, have you done the X-ray? Because normal people, general people, they don't know what are the side effects of X-ray, but still they are telling that have you gone for X-ray? You have the pain in the lumbar region or the spinal cervical region. Have you done for the X-ray? So repeated exposure of X-ray can be fruitful for us to prescribe the X-ray. Because when I came to the this symptomatology of X-ray, then I came that the symptomatology shows that here the mathematically all the masms are covering, but still where to we should strict, because there is some place where to strict, and that I wanted to ask from the sir, that sir will definitely help that the same case osteoarthritis, how can we prescribe the X-rays? Sir, please, sir, reply, sir. Please help us.
The answer is very simple because important Materia and other drugs, they are not very much well proved as other constitutional drugs are. They need to be further improved and finding of grading of symptoms. You will see if you study the literature, like Kent and others, grading is not there. Which symptom is more important? That means which was found during first proving, second proving, and confirmation means clinical proving, clinical observation, and cure verification. Means three stages were not being clearly observed for any one symptoms. That is why those drug guideline is not very much confident to any one of us. But in hypothetically, we can assume that nowadays repeated X-ray is a rare chance because all the doctors they know X-ray is a bad exposure, and if any doctor suggests repeated X-ray, he will be undercharged by the court for negligence of responsibility. So every one of us has become very cautious not to suggest X-ray repeatedly, especially to the mothers, young mothers and carrying mothers, to prevent overuse. Then your gonads, other important endocrine glands. That is why X-ray is nowadays done whenever it is badly necessary or a very long gap. But still, the symptoms of the drug should be repeating. What I have observed that X-ray in the degenerative jaundice I never tried, I never attempted because of this reason. This was not well proved. But I experienced X-ray in chronic ulceration, as we call the syphilitic ulceration, where there was a repeated exposure of X-ray or 2-3 times X-ray in a particular spot, that gets better improvement by X-ray. Still, that is hypothetical. I cannot tell you confirm because confirmation needs a great trial, as it was done by the Hahnemann, by different followers in different places of the country, in different ages, for a long, long years, by different person. Then he concluded, then he put in his picture. These are the symptoms of the drug. That not done but for the drug, but it is necessary, it should be done by our profession for increasing of our weapon.
Okay, sir. One thing more, sir. Am I talk? So one thing more, sir.
Yeah.
Other than the imponderabilia, I wanted to also ask, sir, certain because we know that in our India, in our country, few diseases are means increasing day by day very fast, particularly the thyroid disorder and the diabetes. Particularly, I am talking about the diabetes. So once we are treating the patient of diabetes along with the osteoarthritis, shall we? I know that constitutional treatment means as a whole. It's not like that you use add-on therapy. But if we try to use add-on therapy side by side, whether it will be helpful for us, because sometime what happen, as you also told that the patient, whenever patient are coming, they are not coming directly to us. Definitely, the people already treated by so-called allopathic sites and by the giving the thyroid means component. So shall we continue along with our constitutional treatment? I know that it is very maybe the I may be the wrong, but experience make the person perfect. So an experience can be gained by our seniors. So whatever the view regarding this, sir.
This is not a view. This is evidentially proved. We had a big project on thyroid disorders by 5 research workers, about 23,000 of cases. That was recorded in NIH OPD by 5 research workers, Dr. S.K. Dey, Dr. P.K. Mishra, Dr. Bhavesh Samanto, Dr. S.S. Maiti, myself, 5 doctors, only on thyroid, everybody. Our experience is, especially I can tell my cases, that whenever we see a case is taking modern medicine for a long period, we first take the cases and observe the situation. Is he or he is under crisis? So naturally, immediately withdraw and give withdrawal effect. We must be very cautious. But if we find that patient is controlled 100%, no complaint, physical or mental complaint, simply the blood level is remaining normal by the medicine. Then what we ask the patient, do not stop the medicine immediately. I will tell you when to reduce, when to stop. By what? I will first see the Herring's law of Pure. Is the patient is getting relief of other complaints of the body by our medicine, selected medicine, remaining thyroid level constant, no other complaints, or if the complaints of thyroid disorder, but accessory complaints are going off. Then I will make my drugs confirm that is it the improvement is following Herring's law of Pure? Is the patient is feeling fresh? And is the reports are coming below normal? Then I will usually ask the patient, reduce your dose. Take half or every alternate day for 1 month, 2 months. If you feel better, another 1 month. No complaint, get one blood tested, T3 protease. If it is fine, still it is low, you take every third day for 2 months. If there is no other complaints. If complaints start, again you take alternate. But if there is no complaint, gradually you are improving of your complaints and accessory complaints, then take on third day. Then gradually we withdraw the drugs adapted by the patient or advised by the conventional system of medicine. And we have seen that in our OPD, that traditional drugs can be safely withdrawn if patient continues treatment for few months by our treatment. Number 1. Number 2, we have tried the case is hypothyroid, severe complaint, cardiological complaints are there, neurological complaints are there, but patient symptomatology is very striking, means clear-cut picture of the drug. We are confirmed about the drug. Then usually you have taken the risk that stop the medicine, allopathy medicine. Take our hydrogen 3x and observe your complaints, how you feel. After 1 month, test T3D4 see whether it is still at the same level, means not increasing. Continue 3x along with the medicine for few 1 month without asking the patient to take conventional medicine. This by the 2-3 months, if you find the patient normal, take off your thyroid 3x. Stick to your consistent drug. This tackling depends on the situation of the case. I will tell you one case. One grave disease was carried by Philomis to our OPD. She was trembling like anything, eyes were coming out as if complete severe grave disease. But when he was taken to the IPD in admission, when my juniors were taking the case, then we found that Philomis, no one family members have come. They are replying and they are saying, oh, we do not know what he likes. We do not know how he is angry. Most of the complaints, patient is not able to tell because of the suffering. He is trembling like anything, trembling, not able to talk properly, flashings of it, high blood pressure. Other members are telling. Then it was very striking that why none of the family members came with such a type of patient who needs immediate admission. Then they told that there are many complaints in his family. He is completely neglected, alone, and very nicely. That's why we have carried the patient for his recovery. Then what we did, we immediately stopped the medicines. Because for the patient, she was taking thyroid medicine. But for the mental circumstances, those medicines were not able to control completely, or those medicines are somehow has become irritating for the person. Means disease remains in the mind, but resulting thyroid disorder. But medicines are given to control the thyroid disorders only, keeping mental symptoms as it is. We immediately stop, put him in the IPD, given that miraculous result that was published in our bulletin. Miraculous result. Within few days, complaints came back. Within few days, blood report became normal. He was left within 3 weeks from the IPD with normal thyroid report and fresh and with confidence. Now, confidence is such a level that now, when you ask that how you will manage your family member, the patient replies during the day of discharge, "Well, I will fight." It was the change of mind. The mother was not able to fight with family members for his lifelong with 3-4 children. After getting Netamir in the IPD, he is telling, "I will fight." from tomorrow. This is homeopathy. So
Okay.
this cure control is completely dependent on cases. We must keep the patient normal. We should not allow the level to go up. We should observe the accessory complaints and the complaints. Then accordingly we will decide.
Okay, sir.
For all cases,
Thank you, sir. Yeah, sir. Actually, I'm talking about the diabetes. Thyroid, that's no, but nowadays diabetes is getting much in India than the thyroid. Thyroid is particular in the certain areas it is more, but other than diabetes is in the whole country. Thank you for your valuable information and
there I am
now,
giving the example because the same technique is taken for diabetes too. Due to degenerative jaundice, many of them diabetic, but we did not ask the patient to continue the drug unless it is badly required. Threatening condition. Gradually with the not cure thyroid medicines. And we have seen. I was telling the accessory complaints can be completely cured. I have seen number of cases. About 90% cases, accessory complaints are going off, whether it is diabetes or whatever it may.
Because I was thinking that the diabetes, that particularly where the patient are already obese, and once the patient is obese, there is more chances of osteoarthritis. So simultaneously, we have to treat the diabetes and the osteoarthritis. That's why I started the topic this one. Thank you, sir. Now I think time is.
If you treat the diabetes, if you treat the diabetes, DJD will automatically be cured. If you treat the DJD, diabetes will automatically cure. This is the beauty.
Definitely.
Thank you for asking this question.
Oh, thank you, sir. And thank you to the Bidyut. Now over to the our inaugurator, Dr. Pritha. I think time is also because sorry, because in the morning I have to go for the Midnapore, so that's why I'm a little bit hurried. Okay, thank you, sir. And now over to the Pritha.
Thank you all. Over to Pritha to conclude the session tonight.
Okay, the inaugurator and the concluding person. Thank you so much. It was so wonderful listening to you, Kalyani sir, and to Dr. Akashbonti. It was really, really wonderful. And thank you, Bidyut, Praleda, Dhiraj Bhaiya, for sharing this platform with all of us. And that's all what I have to say. Thank you so much.
Thank you and good night to all.
Good night, everybody. And with this, we are concluding our 70th episode. And we'll be back on the probably 14th of May with our 71st episode of CME. And our request to all the alumnus of NIH across the globe, do be our speaker. And hats off to Akashbonti, she being a very young new generation homeopath over here. She has came forward to be a speaker. So don't hesitate, be a speaker and just get in touch with us. Good night. Thank you.
Good night. Thank you,
sir. Good night, sir.